So what is your approach? If somebody comes in as a new patient and maybe they're diabetic or maybe they've got some other comorbidity, how do you treat them? Is it a more of a holistic approach? Is it all about manipulation?
I love that question. And holistic is a loaded term, but we don't do it, it's hands-free. I only touch people like 2% of the time. So there's very little manipulation or manual therapy, and we really want to hear people's story. So we're passionate to hear people's story, and we ask a very simple question. Tell us what matters to you. And we unpack what matters to them. What do they value? What are they striving to get back to? Instead of focusing on their symptoms, we want to get to the upstream things that are really their goals. And when I know a person's goals, we can reverse engineer the steps to get them back to that. So it's very much person-centered. It's not about me, it's not about my techniques. It's about them, and it's about what matters to them.